I should have had that for a letter for the principal. Until my child's eustachian tube is fully formed, expect him to say and do the weirdest stuff in class.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Jordan Strong and Kevin Ziener.
Welcome back to another all-new episode of Ask an Audiologist. I'm Kevin Ziener.
I'm Dr. Jordan Strong.
Written by Dr. Matthew Seldine of Hearing Partners of South Florida in Delray Beach, Florida. We are going to set our sights on the adolescent side of hearing loss as we chat about peripheral hearing loss in kids. So, Dr. Jordan, I know of peripheral vision, so as it relates to the eyes, but I have no earthly idea what peripheral hearing loss is, let alone in kids. So, So give us the nuts and bolts of like what even is peripheral hearing loss before we tackle the kids subject.
Yeah, so peripheral basically means outer.
Okay.
But with our hearing...
Is that really what peripheral means?
Yeah.
Okay.
Just kind of distant, if you will.
That makes sense because then on my eyes it'd be like the outer portion of my... You're so smart,
See?
I'm telling you. I'm telling you. This is why you're here, because you say the things that obviously I should know, and you say it in a way I'm like, that makes sense.
There you go.
Perfect.
That's why I'm here. Here we are.
Thank you for educating us. That's why I asked an audiologist.
There
Peripheral,
you go.
outer.
Bingo.
Love it. Okay.
So what that means is that we have the outer, the middle, and the inner part of the ear, but we also have the brain portion of our hearing. So it's kind of four components that makes up how we hear.
Got it.
So peripheral hearing loss means that it's everything up to the brain.
Okay.
So at that point where the inner ear and the nerve meet to go to the brain, it's in that area.
Got it.
So everything before that would be categorized as peripheral hearing loss.
Got it. So would this be fair to say, and I'm taking a stab in the dark?
Sure.
The majority of hearing loss is peripheral hearing loss?
Yes.
Okay.
Yes.
Where am I wrong?
No, it can happen to where it's something that's more centralized, something that's more at the brain level, the processing level.
Okay.
But yes, I would say the majority of them are peripheral.
Got it. And so I've just literally never heard of peripheral hearing loss. Is that a common term within audiology? Or do we try to be a little more distinct with it?
Yeah, typically we tend to be a little bit more distinct. I mean, audiology lingo will say peripheral, but for the most part, we kind of categorize it a little bit more than that.
Got it.
Yeah.
So if we've diagnosed someone with peripheral hearing loss, then the next stage is to kind of go a little more granular with what it would be. And so now, how or is this different in children than adults?
So it's really not.
Okay.
With kids, it's just going to depend on early identification.
Okay.
Catching this thing as early as possible. If it's something that's going on from birth, thankfully, new things have been put into place where I believe in all states now, we do a hearing screening on all babies and infants that are born in a hospital.
Yep.
And then there's a follow-up to that if anything is abnormal.
Got it.
Where they will go see an audiologist for more testing.
And that's not when, as we've mentioned a few weeks ago, when we do the otoscopic exam, we can't tell if there's peripheral hearing loss from that, right?
Right.
So even when we line up the kids and we're just checking all their ears, we don't have any idea. We have to actually do a thorough exam.
Right.
Okay.
Right. Yeah.
And so why this kind of probably gets us into, peripheral hearing loss in adults is different just because they're adults. And so maybe they've lived an entire life with hearing, and now they just are having to acclimate to the change of hearing loss. Hearing loss in children comes with a potential battery of issues for that
Absolutely,
child, right?
Yeah.
And what are some of the most important ones in your frame of mind, like that enables or hinders a child's learning?
Right. Yeah. Just language and development in general. If we're not able to receive those sounds, we're not going to be able to produce those sounds.
Sure.
Not without extensive therapy, at least.
Yeah.
So catching that as early as possible. If it's something that's from birth, then we can go that route.
Yeah.
Or it can be something that we know may be progressive, even with a child.
Got it.
So they didn't have hearing loss at birth, but maybe once they get 5, 8, 12 years old, whatever that may be, they start to have this progressive hearing loss, whether that be something that is genetic or, viral or something else that's kind of playing a part in that, but it's causing more of a condition there.
Is that somewhat common when, I assume every year, if there's not an issue, a child should get their hearing checked, just status quo stuff.
Sure.
How often, how frequent do we see that degradation of hearing loss in a child? Is it fairly common, not common? Is it symptomatic, congenital, like you talked about?
Right. It's common, I guess. Now in my field, I don't see only pediatrics.
Sure.
So I don't see it quite as often, but definitely within the pediatric world, it can be pretty prevalent.
Yeah.
Different syndromes, different diseases, different things like that can really play a part in that. So
Got it.
early detection and treatment, because of language and development. Yeah.
What are, not a parent, hand up, not a parent, so I don't have a kid to do this on, but what are some signs, some symptoms, some things that a parent who's listening to this podcast should be on the lookout for if they think their child might have some type of peripheral hearing loss?
Yeah. So as far as a baby goes, you're looking for that babbling, cooing, all of those things, and normal progression of that. If at any point that stops and you're not noticing that quite as much, red flag.
Got it.
Or if they never start to babble, that may be something to be concerned of. And then as they age, things in the classroom can start to become a problem. They may or may not say, I can't hear the teacher.
Sure.
They may act out. They may say, I need to sit closer to the teacher. Just different things like that could show up. But it is definitely more difficult to see it on a kid than it is for an adult.
Sure. I had tubes in my ears when I was a little kid. Tell me again what tubes in the ears is?
Pressure equalization tubes. So PE tubes is what we call them.
Because I was a monster chunk child, so everybody just assumed I wasn't walking or crawling because I just, weighed a metric ton. But then I blew past the time a toddler infant should be crawling, and everybody was just like, this huge unit of a baby should at least be moving. And they found that I had fluid in my ears. And so to me, it was just like, stay on the floor as long as possible, because that makes a lot more sense than trying to get up and lose my equilibrium. I do believe my mother thought I was totally deaf at some point, because nothing happened until the doctor said, oh my gosh, he's just got so much fluid in there.
So much fluid. And then when it sits back there for a really long time, it can actually build up, and we'll refer to it as a glue ear.
Oh, really?
Where that fluid is so thick that as the ENT or the physician goes in there to put those tubes in, they'll clean out behind there before they put the tube in, so that all of that fluid can drain out as it may come back.
One of the other things that maybe some parents are like, oh, well, my child acts out, so maybe they have hearing loss. And I'm sure that's what my mother wished I had when I was acting out in every single grade I was ever in. I could still hear absolutely fine. So that was just symptomatic of me being, a bit of an irritant.
Sure.
So maybe your child doesn't have hearing loss.
Right.
Maybe they just have ADHD.
Right.
Anything else as it relates to this? Just make sure that your kids are always getting checked, more or less.
Yeah, absolutely. Definitely annual hearing tests. It's pretty common that we have our vision tested. I would definitely say it's more common than our hearing tested. You should definitely be doing both of those.
Okay.
Especially
with
for
kids. Got it.
Yeah. And if you know that they're prone to ear infections, stay on top of that. That's huge. Yeah.
And that's like, ear infections are super common in children, true, right?
Absolutely.
Just because they just get in everything?
Well, more so it's actually the anatomy.
Oh, okay.
So they have, we have a eustachian tube, which basically connects our ears to our nose to our throat.
Got it.
And when we're young and as a baby, that tube is pretty flat. So there's not much place for that fluid to go.
Sure.
But as we age, it tilts more and more, allowing that fluid to drain out, let gravity do its work.
Amazing.
Yeah. So that's why it just sits.
Fantastic. And now we know that's why kids like me act up, because our eustachian tubes aren't fully formed yet.
Maybe not.
I should have had that for a letter for the principal. Until my child's eustachian tube is fully formed, expect him to say and do the weirdest stuff in class.
That's a stretch.
Okay.
But sure.
But I'm 6'7", so I could stretch. And now that both myself and the listening audience are both educated on this subject matter, feel free to continue your audiology educational journey at askanaudiologist.com. Dr. Jordan, thank you as always.
Of course.
We'll see you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
CDC puts into place these developmental milestones, right?
Yeah.
And there are developmental milestones for all things life related, right?
What about 38-year-olds who host podcasts?
Yeah, well, the CDC has a lot to say about you.
They sure do.
Yeah.